There is no extra NHS funding without reform, says the Prime Minister. We're going to read into this more from the BBC, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the BBC with the headline of "No extra NHS funding without reform," says the Prime Minister. There will be no extra funding without reform, so Keir Starmer says, as he promises to draw up a new 10-year plan for the health service. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. That's it. No funding without reform is what the Prime Minister is saying. Now, I do believe that majority of people believe that there is essentially a reform that is needed with our national healthcare service. I think everyone is in agreement with that. The question is what kind of reforms are we talking about here? And unfortunately, we all know the one that, for those who have been paying attention to the news and politics, the one that they're talking about more than anything is privatisation. Now, while they have said that they are going to keep it at least free to the point of use, we know that they have said that they were going to be using private healthcare to help shore up so-called, how can I put this? They want to use the private healthcare sector to help clear the backlogs and the issues regarding our national healthcare service, rather than actually detangle and retract less and less of the private sector and private businesses who have such a clause sinked deep into our national healthcare service that is sucking so much of the taxpayer money that goes into our healthcare service, that goes straight into our NHS and goes straight out into the pockets of some of these private healthcare sectors, rather than detach them from our national healthcare service. It seems that we're going to be doing the opposite of that and using more private healthcare to clear it. Now, unfortunately, because of the situation that our national healthcare service is in, many people have turned to private healthcare because, well, quite frankly, their lives are depending on it. In order for them to continue living their lives, they have no choice. For some who are on the lower end and have no money, they can't afford to do it. They can't afford that treatment. And it's extremely frustrating. And when people generally don't care, I would say, about whether or not the NHS is private or public. I think for them, it's just a case of, like, I want to get my doctor's appointment, I want to get my GP. People still want it free, but they don't care if it's NHS, if it's private or whatnot. If they can go in and get the appointment that they need, get the doctor that they need, get the treatment that they need, generally people are not really too fussed on that remark. Now, I could be wrong. It depends. It varies from a certain place. We are talking specifically here about the NHS in England. I'm not going to England and Wales specifically. I'm not going to comment on Scotland. I think it's a different kettle of fish, because I think it's a lot better managed in Scotland than I would say than the rest of the UK. I would say in that regard. But it does vary, obviously, in certain parts, because I have heard in certain places where the NHS has been absolutely fantastic for some people and they get the really nice service. And then there was like a TikTok clip not too long ago about someone screaming about how she was in, one woman who was in serious agony and pain. And every time she spoke to a GP, every time she talked to them, and they kept saying, oh, all you need is paracetamol and whatnot. And her response was, no, I actually need help and you're not helping me. And in the end, that she had to go private because it was just too much for her. Now, obviously, we also have a shortage of doctors and nurses, as among other workers within our national healthcare service as well. We obviously know that pay has been an issue as well, to add on top of all of this as well. A lot of our workers as well came from the European Union, and obviously with the impact of Brexit and our recovery from the coronavirus. Obviously, when the pandemic struck, a lot of those workers went back to their home countries, which is totally understandable. A lot of them have not been able to come back in because, again, of Brexit. So we've been bringing in we have been bringing in some NHS workers or qualified doctors and nurses and whatnot from outside the EU to help try and shore up some of it. However, obviously, it plays into the hands of those of the whole immigration hands as well. So What reforms would I recommend? When in answer to this question about it, I hate our health secretary. I really do, because I don't generally believe that he cares about the well-being of people in this country. I generally believe that he is making the changes he makes in order to please his paymasters. I have heard so many rumours, so many stories about him taking money from health insurances, from private healthcare, what's not. While they haven't appeared on his donation list, they certainly have been circling around him without a shadow of a doubt. And I just kind of wish that he had got kicked to the curb at the general election. I would have gladly have wished he had got kicked to the curb rather than Jonathan Ashworth, if I'm honest. Yeah, I know he's, to some people, he's a bad apple as well, but it just would have made better if West Streeting had gone. But I mean, he says that he wants to get the NHS on its feet, and we all want the NHS to get on our feet. The question is just how we're doing that, the policies that come into its place. And I really hate the fact that we are going more and more towards private care for our health. And I just think that eventually we're just going to, I do fear that we will come at a point where people are going to end up paying out of pocket more and more for their healthcare. To me, healthcare is a human right. It's a human right regardless of who you are and where you are in the world. Of course, nothing is free, but everyone pays in to our national healthcare service in the UK. And we should be extremely grateful for the fact that we even have an NHS, because there are many countries out there that don't have a system like we do. 14 years ago, our NHS was one of the best on the planet, and now it's in an absolute critical state. And we have to do everything we can to try and protect our national healthcare service. Now, not just from what has been 14 years of destruction by the Conservatives, but now we have to try and protect it from this Labour government who, from all intents and purposes, looks like that they want to take it away from people. At least that's the perception that I have, given that they intend to use more and more of the private sector. So there will be no extra NHS funding without reform, so Keir Starmer says, as he promises to draw up a 10-year plan for the health service. The pledge came after a damning report warned the NHS in England was in a critical condition. Prime Minister said the new plan, expected to be published in the spring, would be the biggest reimagination of the NHS since it was formed. However, the Conservatives said the government needed to turn rhetoric into action after scrapping its plans to reform social care and build new hospitals. Well, the Conservatives wanted to build 40 new hospitals, remember, but they didn't have any money to do it, and a lot of them weren't even hospitals, or a lot of them were the same hospitals and never put the money in. Now, if you're going to make a pledge, at least back it up with some money. Or, or the other thing, obviously, is that they're going to be looking to try and get some private money involved, but never came to be. I do agree with social care does need some reforms as well. Keir set out 3 key areas for reform: the transition to a digital NHS, moving more care from hospitals to communities and focusing effort on prevention over sickness. I do agree, obviously, stopping being sick in the first place, stopping highlighting like early cancer signs before it becomes a bigger problem. All these kind of things I think everyone agrees with, and I don't think anyone has any issues with us going a bit more digital. I know I don't use the NHS app, but my understanding is I've had a look. I mean, I've got an Apple phone, so I don't know what the NHS app, for those of you who do use it, is like. But my understanding is that it's not very popular, the NHS app. It is problematic according to some of the reviews I've seen on it. But if you're somebody who uses the NHS app, please let me know down in the comments below what it's like. Because I do think that, while of course it is still very important for us all to be able to speak to a doctor, speak to a doctor or medic in person when you need help, I also think it's important that can help drive down the needs of people coming into their GPs and whatnot. It's an NHS app if you're able to use it, especially when non-emergency issues or non-illnesses, like if you've got a certain thing that you keep having, like let's say for instance right now I've had a bit of a throat infection a couple of weeks ago. I still haven't fully recovered from it. I've been taking lots of things for it, and let's just say another month later or a couple of weeks later, I'm still got this thing and I'm not sure what to do. Rather than me calling up the doctor, what I would do is I would go into my pharmacy and I ask for something stronger, And if the pharmacist can get me something to help me get over it, great. If I still continue to have a bit of a cough and it's still not going away, then I would go and speak to my doctor and say, look, this has been going on for this long. I've taken these medicines. That's what you would normally do. Instead, after you've been to a chemist and they've given you something and that thing hasn't been well, you would be more inclined to say, go onto the NHS app, type in all these issues, all these symptoms and whatnot, and then you send that information off to your doctor or your GP. They can read it up and then get back to you, rather than you go and explain the symptoms. But sometimes meet that one-on-one is far better, obviously, than on the app. But the idea is obviously to try and take some of that burdens, take some of that important time that the doctors and nurses have on their shoulders at the moment, to try and help mitigate that. And the use of obviously more and more technology will help us, rather than video calls as well. There is lots of fundamental work that still needs to be done in order to make those necessary changes. And I have no problem with the use of more technology, especially if it means reducing the workload on our doctors and nurses. But that's just an example. Obviously, not every example can be the case of just filling in details on an app or whatever. It's every situation, every disease, every whatever thing you might have is different. So I just want to stress that there. I just wanted to stress that. The report was the result of a 9-week review by the independent peer and NHS surgeon Lord Darzi. He was asked by Labour shortly after the election to identify the failings in the health service, but his remit did not stretch to coming up with solutions. His findings present a stark picture of a service which says it's in a serious trouble with declining productivity, ballooning waits, and awful emergency services, but puts patients at risk. Responding to the report during a speech in London, Sir Keir said the problem would not be solved by just more money. We can't duck long-term change. This isn't going to be solved by more money. It's solved by reform. Sir Keir said it would be so different from everything that has gone before, as he's talked about changing into a neighbourhood health service. This would mean more tests, scans and healthcare offered on high streets and town centres, along bringing back family doctor and offering digital consultants to those who want them. Hear me when I say this, no more money without reform. Well, what I will say is that the problem is that while a lot of money does go into the NHS, a huge amount, there's a lot of money that is wasted because it goes straight into the private sector rather than actually going to our national healthcare service. So how about we stop giving so much money to the private healthcare sector? How about that? That would be a good start. Speaking in the House of Commons, Health Secretary Westry pledged to be tough on ill health and its cause as he evoked the spirit of New Labour. He gave a nod to Sir Tony Blair's tough on crime mantra as he outlined a national mission to improve health opportunities across the country. Mr. Stream said he wanted to be honest about the problems facing the NHS and be serious about fixing them as he updated MPs about the raw, honest and breathtaking Darcy report commissioned by the new government. The report from Lord Darzi, who served as Health Minister in the last Labour government, said the NHS is still struggling with the aftershocks of the pandemic and the failing well short of key target areas for cancer, accident emergency and hospital treatment. He said it was contributing to poor survival rates in the cancer and heart disease and falling rates with satisfaction with the service. So this graph here, this is obviously from the King's Fund and Nutfield Trust. Public satisfaction with NHS is at a record low. Percentage of survey respondents said they were quiet or very satisfied with the NHS in Britain. This is from 1983 to 2023 here. Obviously, there's some bits that aren't available there, but yeah, it has pretty much dipped over the last several years without a shadow of a doubt. Thanks, Conservatives, for that. It also notes that since 2020, the survey has largely moved online. The impact of this and the result is judged to be minimal. Data not available for every year. The authority has said that the NHS has been left chronically weakened by the policy of austerity in the 2010s and in particular lack of investment in buildings and technology. Yeah, remember, let's not forget, the Conservatives let the NHS, didn't invest in the NHS, didn't give it new funding, enough funding that it needed. Let me reiterate. They did give funding, but not the funding levels that was required to keep it going at the same levels that it was under the previous Labour government. And they certainly weren't giving doctors and nurses the pay that the pay rates that they were in deserved as well. And they just allowed it to continue on and on and on. for year after year after year. If you remember many times throughout the Christmas periods, guys. I remember reading on the stories about NHS overwhelmed, because of the winter crisis. They kept having this year after year after year. And what was the Health Secretary Matt Hancock doing most of the time? Nothing. He didn't do nothing about it, and he was told that they needed more funding, that they needed more things, and he sat on it. The NHS has crumbling hospitals, fewer scanners, and many other developed nations, and in years behind the private sector in terms of digital innovation. It says it has contributed to falling levels of productivity in hospitals, with rises in staff outstripped by increasing numbers of patients needing care. And it means hospitals have been sucking up an ever-increasing amount of the budget, with even more care should be shifted into the community. Lord Darzi was also critical of the disastrous 2012 reforms introduced by the coalition government, which led to the shake-up of management structure in the NHS and acted as a distraction for the rest of the decade. It said that all contributed to the NHS entering the pandemic in a depleted state, leading to the cancellation of more hospital treatments than any comparable to the country, and the ballooning waiting list, which currently stands at 7.6 million. Meanwhile, the surge in patients suffering several long-term illnesses such as diabetes, high blood pressure and respiratory illness is threatening to overwhelm the NHS, along soaring levels of mental health problems among young people. Lord Darzi said, although I've worked with the NHS for more than 30 years, I've been shocked by what I found during this investigation, not just in the health service, but in the state of the nation's health. Excuse me. Yeah, I'm not sounding too great either. Sorry, guys. This is a source from the NHS England data to June 2024 here. This is long waits for treatment in England. The number of waits for hospital in treatments in millions there. You see more than 1 year, 18 weeks to 1 year, or up to 18 weeks there. And you can see those numbers have just rapidly increased. You can see from 2010 onwards, you can see the increase. From 2007 to 2010, that's where, you can see Labour bringing that down. And then obviously since then it's been going up and up and up under the Conservatives. There was a slight dip, of course, because of the pandemic, but then it's just skyrocketed. So it's not rocket science to tell who's been in charge for in that period. Shadow Health Secretary Victoria Atkins said the government has yet to come up with a meaningful plan for reform, and you guys have 14 years to do something about it, and you've done bugger all. The Labour government will be judged on its actions. It has stopped new hospitals from being built, scrapped our social care reforms, and taken money from pensioners and fined unsustainable pay rises with no gains in productivity. She also defended the Conservative government's record, saying the NHS budget had been increased during the last Parliament. Yeah, nobody's denying that you haven't increased the budget, but you've let it rot as well. The Lib Dems leader Ed Davies said the Tories have driven health services into the ground. Fixing the NHS is the country's greatest challenge, and the new government must make it their top priority. Rachel Powers, the patient of the Patients Association, said the findings were deeply concerning, but sadly not surprising. This diagnosis report tasks provide a stark and a necessary assessment of the challenges facing our NHS, but we mustn't stop normalising the abnormal. I agree on that. I don't think we should be taking anything that the Conservatives, especially from Victoria Atkins or Matt Hancock or any of those Conservatives who have been Health Secretary during the entire time the Conservatives have been in power. Don't take anything what they say seriously, considering what they have left the National Healthcare Service, the state that is in, particularly here in England. Yes, people have said, but Wales is worse off. It doesn't matter whether another healthcare system somewhere else is better or worse off. They are still both in terrible conditions and need to be, and fixes need to be made. And I agree, there needs to be long-term fixes, long-term reforms. I do agree with that, but my gripe is the way it's going to be done, and that is the use of privatisation, which I don't agree with in any way, shape or form. I just feel like more and more as time passes, they're sinking closer and closer. The privatisation is sinking their teeth into it, and it's a very scary state of affairs, you guys. I do fear for our National Healthcare Service. I really, really do. But what do you guys think? What do you guys make of the Prime Minister's statement? What do you guys make of the state of our National Healthcare Service in England and Wales in particular? What do you guys think? Do you think that what they are doing is justified? Let me know your thoughts and more down in the comments section below. If you found this video interesting, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video, and subscribe because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.